Welcome to Now What? My name is Rachel and this is Randa, and we're nurses here at the Family Health Center of Southern Oklahoma. And we're excited to be able to be here today to get an opportunity to talk to you about your diabetes and give you some care instructions to help empower you to manage your diabetes better and hopefully keep you out of the hospital. Some of the important facts that you need to know is that admission rates to hospitals are highest in our diabetic population. Patients with diabetes also have the highest readmission rates to hospitals. A lot of those readmission rates are usually due to complications from diabetes, but most of those readmissions and admissions could be prevented with early detection, medical and nutritional compliance, and just early response to getting proper treatment. Also, amputations make up the majority of surgical interventions for patients with diabetes. Every day, 4 people lose a leg due to uncontrolled diabetes. And smokers with diabetes have 5 times the more likelihood of an amputation. So all these things are to tell you that it's important for you to know that there is a delicate balance between your diet, your exercise, and your medication regimen. And Randa's going to talk to you a little bit about some of the problems that can occur with diabetes and hopefully give you some information to prepare you a little bit better.
Okay, so hyperglycemia is when your blood sugars get too high. Anything above 180, this can be caused by stress, illness, eating too much, like snacking between meals, lack of exercise, dehydration, or not taking your diabetic medication like you're supposed to. Hypoglycemia is when your blood sugars drop too low, anything below 70. This can be caused by too much medication or insulin, delayed or skipped meals, not consuming enough carbohydrates, overeating, consuming alcohol, or sometimes other medications. The signs and symptoms you may experience for hyperglycemia, some early signs are frequent urination, increased thirst, blurred vision, fatigue, or headaches. Some late signs are fruity smelling breath, shortness of breath, dry mouth, weakness, confusion, coma, or abdominal pain. For hypoglycemia, some early signs are irregular or fast heart rate, fatigue, pale skin, shakiness, anxiety, sweating, hunger, irritability, tingling to the lips, tongue, or cheek. Some late signs are confusion, abnormal behavior, slurred speech, visual disturbances like blurred vision, seizures, loss of consciousness. So what do you do when your blood sugar level is abnormally low or high? Hyperglycemia, you'll take insulin or medication as prescribed, exercise, follow your meal plan, do regular blood checks until glucose level is under 180. Drink plenty of fluids. For hypoglycemia, take something sweet. Drink half a glass of juice, 3 tablespoons of sugar or honey, or 5 pieces of sweet candy. So, what do you do when your blood sugar is not responding to treatment? Make an appointment with your doctor if you're having trouble keeping your blood sugar in desired range several days a week or more. If your blood sugar remains above 240, even if you've taken your diabetic medication. If you're sick or have fever, experience ongoing diarrhea or vomiting, but you are able to keep food and fluids down. Call 911 or go to the emergency room if you're sick and cannot keep fluid or foods down. If your blood sugar is persistently above 240 and you have ketones in your urine, Make sure a family member knows when to call 911, or if you lose consciousness and cannot swallow food or fluids due to low blood sugar. So what about foot care? Diabetes damages the nerves and blood vessels in many areas of the body, including the feet. This can mean a person's feet do not get enough blood and oxygen, and hence wounds tend to heal more slowly and get worse faster. Additionally, nerve damage leads to reduced sensation, making one more prone to energy while less likely to recognize it immediately. Feet require special attention, and daily foot care is essential to avoid serious issues such as vascular disease and injury. Tips for foot care: check your feet every day. Daily care can prevent serious problems from occurring in the first place. Carefully check your nails between your toes and entire bottom surface of your feet. If you notice any cuts, blisters, redness, swelling, ingrown nail, or any ulcers on the bottom of your feet, seek medical help immediately. Clean your feet daily. Make sure to wash your feet with mild soap and water thoroughly, particularly between the toes. After washing, dry your feet completely. Don't use hot water bottles, hot foot soaps, heating pads, or electric blankets because you may burn your feet without even realizing it. Keep your skin smooth and soft. Use moisturizing cream or lotion to keep your feet soft and smooth. Preferably, apply a lotion that your doctor has approved to prevent cracking. Avoid applying lotion or cream between your toes because this might cause an infection. Take care of your nails. Cut your toenails regularly and frequently. Cut them straight across and don't trim them too short. Protect your feet with appropriate footwear. Poorly fitting shoes that do not support the foot can lead to sores, blisters, calluses, or even an ulcer. Always wear comfortable diabetic shoes or slippers with softer soles to avoid injuring your feet. Never walk barefoot, especially outside of the home. Check your shoes daily for wear and tear. Shake them out to remove any loose objects. Wear comfortable fitting socks. Keep the blood flowing to your feet. Prolonged sitting can cause stasis and blood circulation problems, so moving frequently and exercising regularly is an excellent way to improve health. Don't cross your legs for long periods of times. Watch your diabetes. One can minimize the complications of diabetes by keeping the blood sugars under strict control. High blood sugars can also reduce the chances of infection in the duration of treatment. Remember, poor foot care and hygiene and delay in proper treatment leads to amputations.
So remember, you can take control of your diabetes. Take your medication as it's prescribed. Follow your meal plan. Exercise as usual. Do regular blood checks to make sure your blood glucose is under control. Drink plenty of fluids. See your doctor regularly, but call your doctor with concerns before going to the emergency room. We hope you've gotten something out of this message. We've enjoyed this time with you. Thank you.